Hello everyone, I'm Seçil and today we will give you a presentation about photoacoustic imaging. And here is the outline of the presentation. We will start with the first three titled general informations and continue with the technical informations about PI. Then we will conclude the presentation with new developments and future studies. We will begin with what is photoacoustic imaging. Photoacoustic imaging, a hybrid biomedical imaging modality, is developed based on the photoacoustic effects. Photoacoustic PA takes advantage of fiber optic and ultrasound to detect tumor. Tumors have dense and unorganized vasculature. High density of blood vessels in tumors enhances PI contrast. With the help of conversion of photons to acoustic wave due to absorption and localized thermal excitation, pulses of light is absorbed, energy will be radiated as heat. Heat causes detectable sound waves due to pressure variation. Photoacoustic imaging PI is an emerging radiological technology which generates high-definition volumetric images of tissue by measuring light-induced sound waves from its optically absorbing structures. Through a variety of implementation ranging from microscopy to tomography, PI could be used to visualize anatomical structure, physiological function, and molecular pathology over a wide range of length scales, covering from cells to organs. So, photoacoustic imaging has the potential to image animal or human organs, such as the breast and the brain, with simultaneous high contrast and high spatial resolution. History of PI. As we can see here, we have a short history of photoacoustic imaging. At first, photoacoustic effect discovered by Alexander Bell in 1880. He showed that thin discs emitted sound when exposed to a beam of sunlight that was rapidly interrupted with a rotating slotted disc. Then in 1960s, lasers were emerging. 80s, studies on PA in soft tissue began. So, in 19th, PI in medicine are developed. Finally, we had PA macroscopy in 2006. And here is the selenium cell photophone can be considered the first practical implementation of wireless telephony or the first optical communication device. Although no photoacoustic imaging has been performed on human brains to date, a few studies have addressed its feasibility. Imaging performed on both newborn rats and a human neonatal skull phantom has shown the potential of PET for imaging the brain of human neonates with thinner skulls. If we talk about the types of PI, photoacoustic microscopy PEM is one form of the PI inheriting its characteristics and is useful in both preclinical and clinical research. Over the years, PEM systems have been evolved in several forms. And now I'm gonna talk about the types of PI. There's three types of photoacoustic imaging systems. Photoacoustic thermoacoustic computed tomography, also known as PET or TAT, and photoacoustic microscopy PEM have been developed. A typical PET system uses an unfocused ultrasound detector to acquire the photoacoustic signals, and the image is reconstructed by inversely solving the photoacoustic equations. A PEM system, on the other hand, uses a spherically focused ultrasound detector with 2D point-by-point scanning. And here we can mention about OR-PEM, optical resolution photoacoustic microscopy. OR-PEM clearly and reliably imaged the vascular response through electrical stimulation at the capillary level with a temporal resolution of 1 second. OR-PEM is a promising tool for in vivo studies of neurovascular coupling under a variety of experimental conditions invisibly.
Hello everyone, I'm Sena. Let's look at the working principle of photoacoustic imaging. As Bell discovered more than a century ago, certain materials emit sound waves when struck by rapidly pulsing light. To understand why, it helps to think of the process as two consecutive steps. In the first step, the absorption of light generates heat, an effect that will be familiar to anyone who has left a car parked without shade on a sunny day. The light energy causes molecules in the exposed materials to enter high-energy excited state. This state is not stable. Within a trillionth or so of a second, the molecules revert to their former stable state by emitting heat energy. The same process happens when we shine laser light onto a cell. Certain molecules called chromophores or pigments absorb the light energy and then heat up. In the second step, the heat generates pressure changes, because when an object is heated, it expands. If this happens to light-absorbing pigments inside a cell, the pigment molecules start to vibrate strongly and push on the surrounding structures, causing local changes in pressure. A single expansion is not sufficient to generate sound waves, however. For that to happen, the pressure must oscillate rapidly, which is exactly what occurs if the laser is made to fire a succession of very rapid pulses, each lasting a billionth of a second. The resulting fleeting expansions, alternating with cooling and contraction, generate a high-pitched sound wave with a frequency of 1 to 100 MHz, about 50 to 5,000 times higher than the highest frequency our ears can detect. This sound wave can then be detected and used to produce clear, high-resolution images of biological structures, including those normally hidden beneath other tissues. In this picture, we see a schematic representation of the working principle of photoacoustic imaging: laser excitation, thermal expansion, acoustic wave conversion, ultrasonic detection, image construction. Using photoacoustic imaging, the photoacoustic approach has distinct advantages over the standard imaging technique known as fluorescence microscopy. Here a fluorescent marker is added to a sample and then made to fluoresce by a light beam of a controlled wavelength. In photoacoustic microscopy, no additional marker molecules need to be added, and the technique allows all absorbing molecules, including those naturally present in living organisms, to be imaged. In addition, particle types of molecule can be revealed selectively by changing the wavelength of the excitation light, and using multiple wavelengths allow us to see different tissue components at the same time. Medical applications. Photoacoustic imaging has great potential in medicine, where scientific imaging is an important and powerful diagnostic tool. It is especially well suited to imaging structures that contain blood, since hemoglobin shows up strongly in photoacoustic images. One application lies in tumor detection. When tumors are growing, they trigger the reorganization of surrounding blood vessels, often causing many new blood vessels to form in a process called neovascularization. These blood vessels can be seen clearly by turning the laser to the absorption frequency of the hemoglobin. Preliminary studies suggest that using photoacoustic imaging to reveal neovascularization might be more effective at detecting breast cancer than ultrasound mammography. Another application is in detecting arteriosclerosis, the thickening and hardening of arteries that is often a precursor to heart disease or stroke. For this, imaging has to be done through an endoscope equipped with an optical fiber. The fatty plaque that builds up inside arterial valves in arteriosclerosis is easy to distinguish from normal tissue, as it has a different absorption spectrum. Again, preliminary research has shown the promise of a more accurate diagnosis. In this picture, we can see comparison between X-ray and photoacoustic tomography for breast tumor imaging. As well as avoiding harmful radiation, photoacoustic tomography can reveal an increase in blood vessels associated with tumor growth.
Advantage. Photoacoustic imaging
offers several advantages over biomedical fields. Safe and non-invasive. It is therefore adapted for repeated use on in vivo tissues and is suited for treatment monitoring contrary to X-rays. Label-free. Avoids the issue of approved labels in vivo imaging. Speckle-free. Contrary to OCT and ultrasonography, it provides higher quality images. Scalable. Photoacoustic imaging allows to image biological objects from organelles and cells to tissue or organs while keeping the same height depth. Unwanted side effects. During PA imaging, the skin is irradiated with laser light. For safety reasons, laser radiation should be kept below the maximum permissible exposure. Level of laser radiation to which a person can be exposed without hazardous effects or biological changes. Using a dose higher than MPE limits has been exposed to radiation with the potential to cause pain and burn the patient's skin. It leads to an increase in temperature in the tissue. On the other hand, long-term toxicity and accumulation of nanoparticles remain a concern. These toxicity and accumulation risks are highly variable due to differences in size, geometry, and surface properties of nanoparticles. Most of these studies show that nanostructures larger than a certain size cannot be cleared by renal clearance and will accumulate in biologically important organs such as the liver and spleen. Future. Finally, advances in PAI systems have opened new doors in their application in disease diagnosis, treatment, and monitoring while generating abundant data. Artificial intelligence can be used to use such generated data to translate into clinically interpretable information. The resulting PA image can be converted by artificial intelligence into phenotypic descriptors to better measure their visualization. Such descriptors can characterize, for example, the shape, size, and pattern of vascular remodeling in disease. Clinically, the use of artificial intelligence with photoacoustic images can potentially lead to better disease management and patient outcomes by increasing qualitative assessments by clinicians and offering earlier interventions. Conclusion. Photoacoustic imaging has shown promising capabilities to become a suitable clinical imaging modality with some notable advantages, including high resolution, clinically relevant penetration depth, non-ionizing signal generation, availability of non-radioactive imaging contrast agents, the potential for real-time image acquisition, and the simple integration with widely used clinical ultrasound systems. It has superior abilities to detect deeply situated tumors and their vasculature. Macrometastases in lymphatics and other organs, and circulating tumor cells can greatly contribute to the better understanding of molecular pathways associated with various cancers. Furthermore, photoacoustic imaging can enable physicians to detect cancer at its early stage of development, thus increasing survival rates and reducing healthcare costs associated with cancer treatment procedures. And there are questions we prepared here. Thank you very much for listening. I hope it has been enjoyable and informative.